You guys give me the cue to start whenever.
Okay, I'm gonna introduce you. So after I introduce you, you can start.
Okay.
Perfect. Let's give it a minute for everyone to join, and I will start.
I need a second.
Okay, perfect. We're live right now. Okay. Hi, everyone. Thank you for joining us today for our virtual dental shadowing session. We want to remind you that oh my God, my voice. In order to get your hours, you'll have to take a short quiz at the end of the session, and as long as you get a 3 out of 5, you'll get your hours. All right, let's get started. We are very fortunate to have Dr. Zeina Naous for today's session. I am handing the mic to you. Feel free to start whenever you want.
Yes. Hello, everyone. I'm just having some technical difficulty. Do you guys see my screen all right?
We see the same thing you do. Maybe go to copy at the top, go to copy of.
Oh, yes.
And then, no, that you can go back to that one and then press click to exit full screen. Yes,
Okay.
there we go.
Not the best with computers. Okay, sorry for that. Good afternoon, everyone. My name is Zeina Naous. I am a general dentist. I'm gonna start off with some background info about myself. I was born and raised in Beirut, Lebanon. I'm also a Canadian citizen. I used to live here as a kid for a few years. Then we moved back to Lebanon. Some of you know me from social media. I have a TikTok page. It is getting kind of popular. I'm gonna talk briefly about TikTok. So TikTok is a kind of a new platform, especially for professionals, whether it was it's dentists or medical professionals or any of that sort. What I try to do on TikTok is raise awareness. So you can, if you go to my page, you will see many videos about the dangers or harms or trends that people are doing nowadays that are not, they're not very good. And a lot of young people nowadays, they just want to follow trends. Like here, for example, there's a trend where people are buying some kind of device that people are chewing on. It's supposed to be a jawline definer. It's all really bad, honestly, and maybe some comedy too on the side. But mainly, I'm trying to raise awareness and give some education about the dangers and harms of just blindly following the trends that people are doing nowadays. Yep. So I'm gonna start off with this question. My question is for today is why dentistry? Why did I choose dentistry? There are several reasons that I chose dentistry as a career. The first one was that I love biology. I really hate math and physics. I've always loved the human anatomy, the physiology of the human body, everything related to the system of the human being. Another thing was I like to believe that I have good hand-eye coordination. So it's really good if you can, if you notice that you can like really control your hand function, even especially on a microscopic level. I also fell in love with the artistic side of dentistry. which is, you know, cosmetic dentistry is very famous nowadays. It's not just about, you know, drilling and filling teeth. It's more about changing someone's smile, planning a whole cosmetic procedure. Some people know it as veneers, crowns, prosthetics, all that stuff. It's very interesting. Another reason is that I love to be my own boss. I know a lot of people can relate to that. I never saw myself working in a company. A lot of people, I just love the idea of being in control of your environment. Also, patient care and management is very important. Another aspect is that dentistry combines the business and the medicine aspect. In that sense, if you choose to open a practice, it is in the end also a business. You have to run it like a business, but it's also a clinic. So managing both sides is very interesting. You have the flexibility to make it and shape it to anything that you desire. And last but not least, I love the fact that dentistry is a very, very wide major. You have, I think, over 10 specialties that you can choose from afterwards. So it doesn't mean that it's not like just a major that you choose and you just have to do it. Like, that's it. That's the only thing. No, there's, if you're into ortho, you can go into ortho. There's endodontics, prosthodontics, pediatrics, if you like kids. So many different specialties that you can go into and choose. I personally don't like ortho. I can choose not to ever do an ortho case. If someone loves kids, they can choose to only work with kids. If someone likes to do root canals, they can only do root canals. So you have the flexibility and the choice to choose whatever you feel comfortable with. And during your dental school years, you will experience every aspect of dentistry. You will do endo, you will do a little bit of ortho, not ortho cases, but a little bit pediatrics, everything, prosthodontics, operative dentistry. And by the time you graduate, you can have an idea of whether you want to just be a general dentist, you just want to stick to maybe doing a little bit of everything, or if you just want to stick to one thing. And that's really important in choosing dentistry. Now, for myself, I did dental school in Lebanon. As I mentioned earlier, my university was Beirut Arab University. It was a 5-year dental program. I started in 2013 and graduated in 2018. I'm going to talk briefly about the community work that I did there. It wasn't a lot, but it was definitely an eye opener. We did a lot of school visits where us as dental students go to school and we educate kids starting from preschool up until high school about oral hygiene, about the dangers of doing certain habits, giving them treatment options and plans in general, and just mainly ways to educate the younger ones, because schools don't really implement oral hygiene in their systems. I'm not sure about Canada or America, but in the Middle East, it's not really present in most of schools. So it's really helpful to have that incorporated in the school programs, maybe once or twice a year. Another thing that I experienced during my dental school years was conferences. Conferences were very, very helpful on the fact that they expose you to different, how would I say, different, you get to see, so I was studying in Lebanon. I went to, for example, the International Student Conference in Dubai, and that was a real huge eye-opener. I got to see how dental students in other countries were studying, how they were working, their requirements, what the differences between my school and their school. I got to meet people from all around the world, share experiences from different countries. It was really amazing. Now I'm going to show you guys one of my cases in dental school that I worked on as a comprehensive case. This is just like a brief summary of the cases that we had to deal with in school. It's a little bit graphic, not for the weak heart, because, and I'll tell you in a bit why I'm showing you this. So this was the case of a 30-year-old patient that came to the university clinics. She was a Syrian refugee, and she needed help. She was in pain from all her teeth. She had no money, and she came to the university clinics, and I was the student that got to help her. These are her teeth before treatment. As you can see, very clear decay all over. Her very bad oral hygiene. She did not know. When I asked her if she's ever brushed her teeth, she said she doesn't know what a toothbrush is. So that was really, really, really sad for me to see. And it was kind of like an awakening that there are people like that and they do need our help. These are some of the steps that were taken. The photos are a little rough, but I had to excavate and try to save as much teeth as I could. I did some root canals on her teeth, some posts, and this was her panoramic before treatment. I did some extractions, some root canals, posts, and this was her panoramic midway through treatment. And this is the case, not finished, but this is where I got to with her. I did not get to the final stage of prosthesis, which was, we were planning to do a gum lift and put some crowns, but unfortunately, I had to stop because I was graduating. I didn't have any time, and she came to me a month before I graduated, so this was all I could do. But you can see the change that happened. Her mouth was caries free. I had to teach her how to use a toothbrush. I started from zero with her, and she was very, very happy with the results. After dental school, I graduated. I earned my Bachelor of Dental Surgery, which is a VDS degree. I knew that graduating for me was just getting my degree. I wanted to go to Canada. I had planned for that before, and I wanted to do it, so I just got my degree and I moved away. I'm gonna start with the moving process. Whether you want to move to America or Canada, there are some things you need to know. The dental license. What is the dental license? It is a dental license that is, you have to go through regulations and requirements for the licensure of general practitioners. So each country puts certain rules and regulations that you have to achieve before you are able to work in their country. Why do you need it? You must obtain this license to be able to practice in North America. What is the purpose? The purpose is to protect the health, safety, and welfare of the consumer public, or in other words, it is for kind of like, what was the word, to regulate the amount of dentists or dental practitioners that are coming to the country, and making sure that they are qualified to start practicing. I'm going to start with dental licensure in the US. I'm going to talk after that about the licensing in Canada. So for the US, there is only one path that you can take in order to get your license as a general dentist. I'm not talking about specialists. I'm just talking about general dentists. The path that you take is through the internationally trained dental program. What is the ITD program? It is a program designed for internationally trained dentists that graduated from non-accredited dental programs to allow them to be able to practice in North America. Now, the universities that provide this program can be in America and Canada. So universities from both countries have these programs established. Some programs are 2 years, some programs are 3 years, but they're mostly 2 years. And when you get into the program, you are placed in as the third year dental school student. So dental school in North America is 4 years. So you have 4 years of undergrad, and then you have 4 years of dental school. This program will place you in the third year of dental school, which means you have to do third year dental school, fourth year dental school, and then you graduate. You graduate just like any of their graduates, and you earn, by the end of the program, you will receive the title of DDS or DMD. And I'll talk more about that. So you're probably wondering, how do you apply to the ITD program? And I'm going to explain, because the requirements and the steps for Canada are different than those for America. And since we're talking about America right now, the US, to start off your application to the ITD program, you have to go through something called the ADEA CAPIT Application. And that stands for the Centralized Application for Advanced Placement for International Dentists, which from the name you can tell that this is the only portal that you have to submit all your papers, your transcripts, and everything. And through that portal, it's gonna, you can consider the CAPIT as a little nest that you put everything in, your stuff, your transcripts, your diploma, everything that you have earned. And then the CAPIT is the post office that delivers this information to all the schools. So it's a very, very smart way and helpful way to get like, because when you're applying to like, let's say 5, 6, 7 dental schools, each school is going to require certain things, and it's going to be confusing. But what CAPIT does is it joins them all together into one application, and you don't have to go through all the trouble. So to access the CAPIT application, you go to this website. You will sign up, of course, and you will get 4 main sections. The first section is personal information, which is just mainly your personal information, like your biographic information, contact information, race, ethnicity, anything you want to add. Citizenship information is important. However, you do not have to be a citizen, an American citizen, to apply. You can, when you enter this option, they will give you selection of resident or green card, citizen, visa, student visa, anything that you have at that moment. The second section is academic history. This is probably one of the most important sections in the application. The first part is colleges attended. Now, you have to tell them in the application, where did you go to school? And because this is an ITD program, you probably have been to a foreign institution. Now, there are two organizations. They're very well known and America goes by them. They're called the WES and the ECE, Foreign Evaluation. They are two organizations that you send your transcripts, your degree to them by mail, and they will send you back a foreign evaluation, which they will give you. It's kind of like a report that identifies the United States equivalence of educational qualifications that you have earned this degree and that you have earned this transcript, and this is the equivalent of it in the American system. So let's say you earned your degree, like me, from Lebanon. I sent them my transcripts, my grades, a copy of my degree, and what they did is that they made a copy of it as the American equivalent to that transcript. And that's what the American universities look at, because if they see a foreign institution and they see somewhere from Lebanon or Syria or India or China or anywhere, they don't know what system that your university is following. So these organizations help to standardize the system that will help the universities take a better look at your application and understand it more. This credential evaluation is a key step in understanding the educational backgrounds of candidates educated abroad, which is very, very important. So this is for the colleges that you attended. The WES or ECE will send you back a transcript of the translated or the qualified credential evaluation, and you will mail that to the CAPIT application later on. The second part of the application requirement is the standardized tests. Now, the most important English proficiency exam is the TOEFL. I'm not very sure about the IELTS exam. I tried to go through a lot of university websites and what they require. And I'd say 90% said that they wanted the TOEFL. And in the CAPIT application, they mentioned the selection of TOEFL only, and it's the internet-based test that is preferred. There are 4 sections in the TOEFL exam: listening, speaking, writing, reading. This is basically just an exam that you have to get a pretty good score at. Usually a competitive score of above 85 is needed to have a good profile. They just want to make sure that your English is good, you're able to understand and communicate properly. Another section in the application is the advanced dental education programs. Now, this is not it's not a must to add. You can choose to opt from adding any advanced dental education programs, because as a general dentist that just graduated and you just want to go to the country, to the US direct, and you don't want to waste your time doing any programs or extra programs, you don't have to add this. But however, it does have or add an extra advantage to your application. Some of the programs that you can do or have done are public health, radiology, pathology, anesthesiology, and the programs can range from a fellowship to an internship, externship, anything, master's, doctorate, anything that you've earned. So this would make your application application look really good, but it's not a must. ADA standardized test. Now, this is the most important part. The standardized tests are a requirement for most universities to be able to apply to the ITD program. Now, each university has different requirements. Some of them would like you to have the NBDE Part 1 by itself. Some of them want NBDE 1 and 2. Some of them want the INBDE, and I'll show you later how you would know what each university wants. But these are mainly the standardized tests that universities require for you to have on your profile before you apply. And this is the link for the CAPIT directory. The CAPIT directory is the huge table that basically shows you what each university requires. And I'm gonna show you here. For example, this is half of the table. So each university, it shows you how big their class is for the ITD program. So this university has 16, only 16 people accepted each year. The opening date is April 3rd, and there's the deadline. What they require for this university is either the NBDE Part 1 and 2 or the INBDE, not both. If you have the ADAT, it is accepted, and they even tell you which credential evaluation organization to go and do. So if you send your papers to the ECE, then that's good. If you send them to the WES, they don't accept it. This is a very important thing. So, because you don't want to just send your papers to the ECE or just to WES and then find out later that this university doesn't accept this organization, they accept the ECE. So you have to study this table. This is kind of like one of the first steps that you have to do is look at this table, figure out which universities you want to apply to, see their requirements, deadlines, everything, and then start preparing. I looked at this table maybe a year before I started preparing, just to know what I want to keep in mind before I start. They do update this table every year around this time. So March time, they put a new table in. And this is the continual of the table. So we're still at the ADA standardized test. And as I mentioned, the ADAT is one of the exams that you can take. I never did the ADAT. It stands for the Advanced Dental Admission Test. Who takes this test? Usually third and fourth year dental students. Also dentists that are practicing and want to apply for postgraduate training, and even international dental students applying for the ITD program can take this. Some universities accept this exam in the application and some don't. Now moving on to the NBDE versus the INBDE. You're probably wondering, what is this girl talking about? What is the NBDE? The NBDE, it stands for the National Board Dental Examinations. And the INBDE is the Integrated National Board Dental Examination. So the INBDE is basically the NBDE Parts 1 and 2 together. Now, you don't have to do this, you don't have to do them both, but some people do. Some universities are taking the NBDE in their applications. Some are taking the INBDE. So also important to look at what the university you want to apply to is looking for. What is the purpose of taking them? Both international students and US students take these exams. The international students, they take them because they are a requirement for the application to the ITD program, which is what we're talking about. And for US students, it is a requirement to complete their to complete these exams before they do their licensing in the States. So then the US students would be in their third or fourth year of dental school, and they can do these tests. So basically everyone does them. And that's how you get the title of American Board Certified Dentist. Personally, when I did these exams, the INBDE was not there yet. I did the NBDE Part 1 and the NBDE Part 2, which was this was what was present. This was the only board exams there. I took my NBDE Part 1 in 2017. These are the topics that I studied for. These are the topics mainly in the exam. And I then, after passing the NBDE Part 1, you need over 75, over 100 to pass. I took the NBDE Part 2 in 2018, and the Part 2 focuses more on dental stuff, dental topics like endodontics, prosthodontics, periodontics, more dental specifically related. The NBDE Part 1 was more of anatomy, pathology, microbiology, biochemistry, just general stuff. Mostly the stuff that you take during your second years of dental school. The NBDE Part 2, I'm just not gonna talk a lot about the NBDE Part 1 because it has been discontinued. The NBDE is trying to cancel the Part 1 and 2 and replace them with the INBDE. So they canceled the Part 1, so no one is able to do it anymore. You can still do the NBDE Part 2 up until, I think, August of 2022. It's going to be in another slide. But NBDE Part 2 was a 2-day exam. It had, for the first day, it was 400 questions of knowledge. So basically these topics were in multiple choice questions and you have to answer them. For the second day, it was case-based questions. So you get a full case of a patient, their chart, their Xrays, and you get a bunch of questions on each case and you have to answer them correctly. You might get some photographs, pictures of the patient, the charts, everything you need to know to be able to figure out the answer. This is for the NBDE Part 2. Now, this is what I was talking about earlier. The NBDE Part 1 is no longer available. The NBDE Part 2 will be discontinued on August 1st of 2022, so next year. Yes, so they are trying to get the INBDE, which is just one exam, to replace both parts and make it just that exam in the application. The INBDE is an examination that integrates content from the biomedical, behavioral, and clinical sciences to replace, like I said, the National Board Dental Examinations Part 1 and 2. The purpose, what is the purpose of the INBDE? It's like a standardized exam, just like TOEFL tests your knowledge in English. The INBDE is gonna test your knowledge in the dental field. It's just a knowledge exam. There's no practical parts. And it's gonna assist the dental boards in determining the qualifications of individuals to seek licensure to practice dentistry. This is the INBDE exam breakdown. So it is also a 2-day exam. This is the INBDE. I know it's confusing. I'm trying to maybe explain it and make it a little easier, but this is mainly the, okay, so I'm not gonna go to much details about the exact components of the exam. You can read more about them in the ADA website. Everything I'm saying or talking about is already in the ADA website, so feel free to go check it out. The first is diagnosis and treatment planning, the first part of the exam, then oral health management and practice and profession, and mainly foundation knowledge areas. They have to know if you understand and know different areas and how good your foundation is in several topics like pharmacology, pathology, physiology, and etc. Now, continuing with our application, there is another section which is called the supporting information. It consists of the evaluations. You need 2 letters of evaluation attached to your application. These letters are printed and typed on an office letterhead. For me, I had 2 of my professors from my university. They typed in a letter evaluating my performance and how I was as a student, just a paragraph or 2 about me, and then they send this letter through a portal, also through the CAPIT application. So you never receive their letter, but the CAPIT directly receives it. Now, the other sections are experiences, achievement, licenses, and personal statement. Basically, experience can be anything that you've done, any work, whether dental related or not dental related, it's up to you. Which means if you've worked as a dentist for years, or you worked something else, you can add that to the application if you feel like it's going to be relevant. Achievements, any awards, publications, presentations that you've received, and licenses. Now, it's a tricky part because you're like, I'm doing this application because I want to get the license. What are they talking about? They mean licenses. If you have, maybe some people have other licenses from other countries that they've worked at. Let's say someone that graduated from Lebanon, completed their license in the UK, and then they wanted to apply to America. So they can mention that they have that license. You can even mention any other license that you might have, like scuba diving or something else. Personal statement. It's just a statement, maybe a page or 2 about yourself, explaining why you love dentistry and all that. Now, the last part of the application is adding the programs. You can add as much, you will get a page that looks like this, and you will have the option to add as much dental programs as you want. But the tricky part is that each program that you add is a separate fee. So let's say you added one program, which was $100, another program was $200. If you add 5 or 6, it's gonna add up to almost $600, $700. So if you are thinking about the money, you might have to review the finances first. But if you're rich and you don't care, then add them all. I'm saying add them all because it's going to increase your chances of getting into one of them. But if you're just set on like 2 or 3 that you might actually go to, if you actually get in, then go for it. So the last step after adding your programs is to submit your CAPIT application. All you have to do is submit, and some universities require extra separate fees that you have to fulfill, and some extra requirements. So let's say I applied to Boston University. I submitted my CAPIT application. They might email me and ask me for extra steps, which is very important for you to go to their website, go to each university website that you applied to, look for their requirements through the ITD program, and see what they require in addition to the CAPIT application, because most universities require an extra fee, they require extra letter, or require more transcripts or specific evaluation requests that you need to fulfill in order for your application to be considered. So do the research, look at every university first through their website, and also complete your CAPIT application. Completion. Now, once you get in, let's say you got accepted and you went and did your ITD program for two years, completion of this program will provide you with the DDS or DMD title. This is going to qualify you to work in both Canada and America as a licensed general dentist. This is a very good thing, because earning the DDS or DMD title is something that you can only get if you do ITD programs. You don't get this title if you did, which I'm gonna talk about in a bit, but you don't get the title if you only do exams. Now, you're probably wondering, what about dental specialties? So if I'm a specialist from some country, let's say I'm an endodontist from Lebanon, and I wanna get a dental license as a specialist. What I saw a lot of people, I don't have a lot of knowledge about this aspect because I didn't deal with it firsthand, but I know a lot of students that they are specialists. They already did their specialty in their country, and they wanted to work in the US as a specialist. So what they did was there's certain programs for these kind of people in certain universities. I'm not familiar with the namings, but you can always check the websites of universities and see what they are offering you. Programs for endodontists, like a fellowship or an internship, which will qualify you, depending on what they require, it will qualify you to work as a specialist in that province or state. Now, moving on to dental licensure, I think I'm taking too long, but I'm gonna try to make it brief. Dental licensure in Canada. So the pathway for licensing in Canada, you have to forget what I talked about in the US. It's a different path. It's a little bit more complicated because you have two options for Canada, whereas in America you only have one option. I'm gonna try to make it as easy as possible. This is the path I am taking right now to get my certification. So let's start. You start by going to the NDB bned.ca website, which is the official website for the NDEB. NDEB stands for the National Dental Examining Board of Canada. Now, how to start your process? You have to apply to the NDEB that you want to start the process. You cannot start anything before they approve all your paperwork and forms. So what you do is you start to create an online profile. To create an online profile, you go to the website, you select non-accredited programs. In the website itself, there is a manual, which is called Instructions, the NDB equivalency process. It has every single step that you need to know to start your online profile, including fees and restrictions and anything that you need to know. Once you create an online profile, they will require you to submit your required documents. Now, there are documents that you need to send directly from your university to the NDEB, and there are documents that the NDEB requires from you only. So I tried to put them briefly here. Documents to verify your credentials, like your academic record, your degree form. You also have to send your original degree to the NDB, which is, I know, risky by mail and all that stuff, but this is what they require. So you have to review this step very carefully before you submit anything to the NDB, because they do take a few weeks to get back to you, and if anything is wrong, then or they don't allow, or like in your documents, or any like date or signature is missing, they're gonna make you wait 6 to 8 weeks for each time that you mess up. So make sure before you send everything in that everything is correct. Follow the equivalency process documents folder, which is also on the NDB website. It has all the details that you need to know. Once you submit your required documents, this is a form attached that you can download online. You have to sign and date and also send with your documents. Once you send everything over, the NDB looks at your application and does a credential verification. And your status on the online profile will look like something like this. Once each document is received, they will notify you and tell you that this is received, this is accepted, and then you will get an email that your application is approved. Once your application is approved, then this means that you can start your equivalency process. Now, the first step to doing this, starting this process, is this exam. This exam you have to do whether you are going to choose to do an ITD program or if you're going to just do exams. This exam is called the Assessment of Fundamental Knowledge. Everyone needs to do this test. Every foreign trained dentist has to do this. It's a 6-hour exam with 300 single answer multiple choice questions. You have to get above 75 to pass, and the topics that are included are the ones listed here. It's mainly an exam that joins kind of every aspect of dentistry, knowledge-wise. They test your knowledge. They try to know if you are your foundation and fundamentals in dentistry are valid and good or not. So once you pass this AFK, 2 doors will open for you. You can either continue your path through examinations, which means you have 2 more exams to complete and you will be licensed, or you can go through the ITD branch, which is degree completion programs, which is equivalent to the ITD programs that I mentioned earlier in the US. So you have the choice. Now, how do I decide if I want to go to the examinations or I want to do a degree completion program? There are many factors that play a part in the decision. I would say your AFK score is a very valuable factor in the decision, because degree completion programs, they do require an AFK score that is fairly high. I would say over 85 to have a competitive score to apply to the programs. Whereas to continue in the examination pathway, you only require the passing score of 75. So if you have a score of over 85 or 90 on the AFK, I would highly recommend that you go through the completion program, degree completion program, unless you just don't want to go through school and you just want to do the exams and start working. So there are many factors that I'm gonna discuss more later on in your decision. But let's say that you chose the Degreation completion program, which is very, very, very similar to the ITD that I explained before. It's just as I explained earlier, the International Trained Dental Program that is found in the US is also found in universities in Canada. which is why you can do that 2 to 3 year program in universities in Canada. These are a list of the universities that provide this program. The ones in Ontario are University of Toronto and Western University. The universities also require a TOEFL, your dental degree, your transcripts, and additional fees to apply, in addition to your AFK score, which has to be competitive. Now, not all universities require a competitive score. Universities like Alberta, Manitoba, Dalhousie, they put on their websites that they require a passing score or above 80, so it's not that hard. But it's always important to check the websites of these universities before you start your application process. If this is a path that you feel like you want and this is what you need, so focus on getting a very good AFK score, a very high TOEFL score, get everything ready before their deadlines, even try to apply early to the admissions, and try, because they mostly it's a first come first serve as well, so try to get that in earlier. Also, after you are primarily accepted, let's say, into the program of Western, for example, university, they will tell you, okay, we accept you and your scores are good, but we also require a clinical exam. So some universities, they have a special clinical course that you can take, and you can do it to be able to get to the ITD program. So check each university website and make sure you have everything ready. Now, the other option that you can take if you don't want to go to school and go through all that, you have your AFK done. You have this is the AFK. Now you can move on to something called the ACJ, the Assessment of Clinical Judgment, which is a 5.5 hour assessment, also multiple choice questions. They are divided into Xrays and cases. The Xrays, you have options that you can choose from to see and diagnose what the problem, whether it's caries, calculus, or defective restoration, complications for extractions, or endodontic complications. The other section is cases where they give you a brief case of a patient's file, and they give you the chief complaint and some charts, sometimes pictures, pathology pictures, and they tell you to choose the correct answer for that case. So basically, it's a judgment exam. So you have to be have really good judgment. It's based on practice. You have to see a lot of X-rays, a lot of cases, review, get your eye trained on seeing many X-rays before you're ready to do the exam. The last exam that you can take in the examination pathway is the Assessment of Clinical Skills. Now, this is a practical exam. The AFK and the ACJ were theoretical. The ACS is practical, and it's a 2-day assessment in which you perform 12 dental procedures. I put a list of these procedures briefly here. You train for months on plastic teeth, and in the exam, you have to complete these procedures efficiently, and there is a specific score that you have to get in order to pass. The grading system and the whole logistics of this exam is described in detail on the NDB website, in addition to the other exams that I talked about. Now, this is the map that I'm talking about. So whether you did the exams path or you did your degree completion program, you have to go through what is called the NDB written examination in OSCE, which is equivalent to the, in other words, I could say the Canadian board exams. These are the exams that Canadian dental graduates and foreign dental graduates, after completing their equivalency process, have to obtain before they can get their license. So also everyone has to do these tests. The written examination and the OSCE are the two tests in this section. I have to clarify that in order for, let's say, if you are an American graduate and you did your American boards and or whether you did your license there, you finished your program, and you suddenly decided to come and work in Canada, that does not mean that you have to do your it doesn't mean that you have to do your equivalency all over again, because Canada and America are kind of incorporated in that area. But however, you have to do your NDEB exams, which is the written and the OSCE. So I have a friend that just finished his school in NYU University, and he is currently doing his NDB exams because he wants to live in Canada and work here and work in Canada. So he has to do these exams too. Now, once you finish everything, you are NDB certified, which means you are licensed to work as a general dentist in Canada. And this is a table of submission for postgraduate programs and US, yeah, nothing much here. So this is the map. It's also a different type of map for the equivalency process. Like I said, this is for non-accredited dental programs, and this is for accredited dental programs. The non-accredited, I talked about the general dentistry, the equivalency process, the examinations. And for accredited programs, you go directly to the written and OSCE exams. As for specialty, there is a special examination system for dental specialists. So let's say you are a specialist from a different country, you are an endodontist or a prosthodontist from a different country, and you want to work as a specialist in Canada. There are specialty core knowledge examinations that you can take in order for you to work as a specialist here. So also all this information is present on the NDB website, so you can go take a look at that. Now, what are the advantages of both advantages and disadvantages of taking each pathway? I'd say starting with the examination pathway, the advantages are that by examination pathway, I mean doing the AFK, ACJ, and then ACS. You don't have to go to school. It's less money. It is a lot of money, but it's less money compared to that you will be paying for school tuition for 2 or 3 years. So that's a good thing. But the disadvantages, in my opinion, are that you don't get the school experience in North America, and it's not guaranteed, because this is a very important point. It's not guaranteed because you only get 3 tries. In the up until now, for Canada, you can do the AFK or ACJ 3 times only, and the ACS 3 times. So if you fail 3 times on any of them, then you are disqualified from the equivalency pathway. However, the NDB just released new information stating that you can do the AFK and ACJ up to 3 times. However, the ACS is unlimited attempts. So that's a good thing. The school pathway, the perks of that is the school experience, of course, getting to see firsthand how schools operate in North America, which might be a little different than the foreign countries. You also obtain a DDS or DMD degree, which is really good. However, the negatives are that it's expensive. some people find it expensive because you have tuition for 2 to 3 years. And also, not everyone wants to go back to school, especially dentists that have worked and trained for years in their countries, maybe older dentists that have 10 to 15, 20 years of experience. They feel like they're not ready or want to go back to school anymore. So they choose the examination pathway instead. Financing the process, I'm just going to talk briefly about this. The banks that, so I don't know much for America on this topic. For America, we said there's only one path to take, which is the university path. And for that, I have read online that you can apply for loans and finance your journey through the bank. However, for Canada, there are more options that you can go for. Now, if you are gonna go for the ITD programs in Canada, which means universities, it might be better for you to pursue a student loan, which is what most of Canadian students go for. However, if you're gonna choose the examination pathway, you might want to consider something called a line of credit. Banks are more and more open to providing line of credits for international dentists lately, with low interest rates, no deadline for repayment, and no requirement of citizenship. The interest rate is yearly, so that's a really good thing. You can look more into that and check it out if you are interested. Now, I know I was talking a lot for the past hour, but I'm just going to give you a few brief tips that I myself had to learn the hard way about studying. So the first one is to set your goals and make a plan. This is very important because I get a lot of messages from students, whether foreign or not foreign, or even high school students, and they tell me, I want to do this, I want to do that, I want to do everything. And I tell them, okay, that sounds good, but you have to set your goals, like make short-term and long-term goals that you want to work on, and work towards them step by step. Don't overwhelm yourself with the whole idea of what or where you want to be in that specific time. Just put a short-term goal, figure that out, and those short-term goals will eventually lead you to the bigger goal that you want to achieve. So for example, if you are doing the examination pathway, or whether you want to apply to dental school and you're studying for your dental aptitude tests, set the small goals first and work towards them. And if you do them right, they will lead you to the bigger goal that you want to achieve. The second one is it's okay if things take longer than you expected. I'm a person that's always felt like I'm in a rush, that someone is following me and I need to hurry, and I need to finish everything before I'm 25. I need to finish everything before I'm 30. But I realized that some things are out of our hands, and especially after this COVID pandemic, you don't really have much control as you think you do. And it's okay sometimes to take a step back and accept the fact that you are not going at the pace that you want to, but it's okay as long as you keep going. The other thing is solve more than you read. And I learned this the hard way because in high school, I was always like, I like to read more than I like to solve. But I learned during these exams and everything in licensing that it is very important to solve as much questions, as much tests and quizzes, as much as you can get your hands on. Also surround yourself with positive people. Of course, having support and family or friends that are helpful will be good for your mental health. If anyone is being very negative or just giving you bad vibes around you. You don't need that, so just let them go. Also important, give yourself mental breaks. Don't drain yourself. Don't be too hard on yourself, because in the end, your mental health matters most. So focus on that. Take walks, meditate, do yoga, watch something funny, play some games, whatever you feel like that will get your mind off of things from time to time, because things sometimes do get really stressful. So you have to be able to manage that. And the most important lesson that I want you to take from this presentation is that, and I personally, I'm not afraid to admit this, it's okay to fail as long as you keep trying. And I say this because failing, I used to think that failing was the worst thing that could happen. But I learned the hard way that